Welcome back. Several African countries have registered a decline in reported COVID-19 positive cases per day, leading to the lifting of some restrictions. So today we look at the state of the virus in the country and how prepared it is in case of another wave, which scientists say cannot be ruled out.
Like its neighbors, Kenya has registered a positivity rate below 5% over the few weeks. According to experts, the country is currently registering low new cases compared to the beginning of the pandemic. As of November 14, the positivity rate stood at 0.8%. According to experts, with the low positivity rate, one is less likely to get COVID-19. But scientists warn that the resurgence of COVID cases cannot be ruled out.
In Kenya, we are in a good space right now. We don't know how long it will last, but according to epidemiological modeling and predictions, we should be expecting a fifth wave. We should be expecting a fifth wave before the end of this month. So we are actually closely watching to see whether there will be an upturn in the curve.
A number of COVID restrictions have been lifted with a reduction of positivity rate below 5%, which is in line with World Health Organization guidelines. The political season has attracted gatherings despite the ban of political rallies, and this is ahead of the festive season where large crowds usually gather around social places. However, Kenyans have slowly grown a sense of fatigue regarding the COVID-19 prevention measures from the look of things. So, how prepared is the country in the case of a resurgence?
If we had a problem with oxygen at the time in July, August, and we do not have oxygen plants in hospitals, then that means we're not prepared. I think so far only Moi Teaching and Referral Hospital has expanded number of oxygen plants. So I will say that that facility is prepared to cover in case of oxygen need in an outbreak. But other facilities in other counties, that has not taken place.
Scientists say that there's no need for tough COVID restrictions, but the public must continue to observe standard operating procedures and ensure that they're vaccinated.
Many rural residents are not able to access the vaccine as those in the city. There's need to educate the public on the value of being vaccinated. There's need to make the vaccines available at every facility that is a walking distance to a community.
The key thing right now is to closely monitor and look, are we getting a resurgence? And you'll know there is a resurgence when you start seeing the rolling average. You know, the number of cases increasing on a day-to-day basis, one day becoming more than another, and within a week you are seeing the numbers maybe doubling. Then at that point you need to actually take measures.
According to the Ministry of Health, the country is well prepared in case of another wave. But when it comes to vaccination, as of November 15, about 2.1 million Kenyans had been fully vaccinated against the target of the Ministry of Health of 10 million by end of the year.